Good afternoon, and welcome to our Oak Bend Medical Center Happy Hour podcast. My name is Donna, and I am your host. Today, we have a very special guest to speak with us about wound care. Kenchen Schaefer is a registered nurse with a bachelor's degree in business administration. Currently, he is working on his MBA in healthcare management. He has been employed with Oak Bend Medical Center for 12 years, and for the last 2.5 years, he has served as Oak Bend's AVP of Nursing and Administration. As of late, he has been very involved in our COVID team and helping make sure that our COVID units are running smooth and are up to code. And we want to thank you for all your work and time in that, Kenchen. Thank you and welcome you today. So today we want to talk about wound care. It's not something we always think about. Everybody gets cuts and scrapes. So why would a patient need wound care?
Basically, anybody that has a break in the skin that just doesn't seem to be healing properly, or if it just looks not quite right, that's usually an indication you may want to seek somebody out that's got more of a specialty in wound care.
Okay. So if it's got an odor, a color, swelling, maybe hot,
Heat, bothering, pain, too much pain, no pain.
okay. So we all get wounds. What is the best way for us to care for a wound in the beginning or whatever?
So the best way to care for it really depends on the etiology of the wound. And when I say etiology, it's more than what the cause of the wound is, but more the reasoning as to why is the wound not responding the way it should. People have been taught for many years, we would hear it in wound care all the time, that they're taught to let it be open to air, let it dry out. A scab on a normal person with no other comorbidities, that is a normal part of the healing process. But on a patient that has issues with healing, a moist wound bed is the key to the healing process. I mentioned to my patients that would come in for their first visit, they were talking about leaving them open to air and dry, it didn't respond. You look back at the Band-Aid commercials and they said they help cuts heal however much percent faster. It has nothing to do with the Band-Aid being a miracle bandage or anything that's on it. It's just a matter of it seals it off. If you notice when you take it off, your skin looks wet. It's that maintaining the moisture, which is really what helped it heal faster.
Okay. So I'm going to throw one at you. I've always heard people will say, put peroxide on it.
So on an initial injury or opening of the skin, peroxide is fine because it does get rid of the debris that's on the open skin. But in the long term, it actually will delay healing because as it's bubbling out any of the debris that's in there, the new immature skin cells that are trying to cover this wound are actually also getting dissolved out. So it will actually stall the healing process.
Interesting. So when is it time to see a physician?
So most literature states that if your wound hasn't started healing within about 2 weeks, or if it's not fully healed in about a month to 6 weeks, that's really when you should start looking at going to a specialist. A typical healing process with no underlying problems or health issues, that would be the normal progression of a wound to heal itself. And if you do not see that, then it's time to seek a specialist. Also mentioned that if you have other disease processes that have made you hard to heal in the past, probably immediately is the time that you need to go see somebody.
Okay, and great, because that kind of leads into my next question. Are there certain diseases that contribute to wounds?
Many diseases do contribute to that. Majority of patients that come into a wound care center have underlying other health conditions that really affect the healing, which is why they need to come see a specialist. You have, for instance, diabetes. You will see that in the majority of the patients that do come in, end up having diabetes. Poor circulation is another issue. So if you have a hard time getting blood flow to the area or blood getting away from the area, that can cause it to stall. There's autoimmune diseases, which sometimes people don't think about. Even rheumatoid arthritis, numerous patients have that. It's an autoimmune disease where your body kind of fights against itself. If your body's fighting against itself, it's also not going to repair itself appropriately.
So how would you know if you had circulation problems if no one's ever told you, or are there signs?
So you would look, typically lots of varicose veins are an indication that you got poor venous outflow. Red skin is another indication. Red skin can be started because the blood is pooling in the leg, causing pressure on the leg and cause it turn red. Also, if you're not getting blood flow into the leg or arterial disease, that will cause the legs to be really red as well. It's not necessarily an infection, which most people think it's a skin infection, but it won't be hot to the touch. It'll just be red. Your arterial disease people are usually the ones that can't walk very long without getting a muscle cramp, or when they lay down at night, they have to constantly get up and sit up because their legs are burning. That burning sensation is due to the lack of oxygen getting to the tissue.
Okay. So I would assume in that situation, you probably need to see your physician if that is happening.
You do need to see a physician. There are procedures that can actually correct some of the flow, whether it be blood getting in or blood getting out. Without following up with a physician, you would never know that you have these other options. Most of them are outpatient options. You come in, you can be treated, you go home, and over time, the body starts to repair itself, and you'll see an improvement in the blood flow.
Okay. Are there any ways that you know of that we can prevent wounds from? I know you can't prevent cutting yourself or those kind of things. Those things just kind of happen. But in disease process, is there ways to prevent things?
The key is managing your health conditions. So if you are seeing a physician for any kind of other illnesses, following the medication regimen that they have you on, eating healthy. There's lots of vitamin deficiencies that can cause poor healing as well. Smoking causes the blood vessels to constrict, which again lets less blood flow get to the area. Activity, even just walking, the more activity you do, the better on your body overall health wise. So even if you're more sedentary and you just start getting up and walk down your driveway and back, that's more than what you were doing. That's a beginning on trying to get your health status back up. Another big thing is diabetic patients should always follow their guidance of a podiatrist on which diabetic footwear. I have seen numerous times over and over diabetic patients coming in with a wound on their foot, and it's because they did not have the proper footwear or they refused to wear it. One instance being Crocs. Crocs on a diabetic patient are never a good thing, or any sandals. It doesn't protect the feet. You step on stuff. Most of them have neuropathy. They don't even feel that they stepped on something that stabbed in their foot. And then like with Crocs, you're constantly contracting your toes to hold them on. Now the knuckles on your toes are rubbing inside the shoe, and it's just one thing leads to another after that.
Good to know. I'd have never thought of that. So in wound care, I've heard of hyperbaric chambers. What are those?
So patients, when they research the internet, you'll see lots of information about hyperbaric oxygen. Not all of it's always true. As you know, when you read on the internet, true hyperbaric oxygen is an oxygen chamber. It's an acrylic chamber that you see through. The patient goes into the chamber. The chamber pressurizes up with 100% oxygen. And as the patient is breathing, they're getting these oxygen molecules that have been shrunk down to where they can diffuse into the plasma of the blood, where typically you always hear, what's your hemoglobin levels? That's what your oxygen binds to, and that's what carries the oxygen throughout the body system. Now with the hyperbaric oxygen under pressure, of course, all the science that goes into it and the gas laws and all this, basically the oxygen shrinks down to a small enough molecule that it can diffuse to plasma. So now you have hemoglobin carrying oxygen and you have the plasma carrying oxygen. So you're able to get really high concentrations of oxygen to the wound to heal it from the inside out. Oxygen in the body has lots to do with healing. It can make your antibiotics more effective if you're being treated for an infection. It promotes what we call angiogenesis. So that's new blood vessel formation. So of course, if you have poor blood flow, you would like more vessels to get more blood to areas of the body. The key to it is being in the chamber for the right amount of time to treat the condition. You will see on the internet lots of sleeves that people put on their body, and you can hook oxygen up to it. And they're thinking they put topical oxygen. Your body does not repair that way. You absorb a very minuscule amount of oxygen through your tissue. It really has to be inhaled through the lungs and then fed into the blood to reach where the wound is at.
So is it uncomfortable?
For some people, it can be a little uncomfortable on the ears, but no different than going in an airplane, riding through the mountains. You have the ear pop. Most people, if you swallow, then of course, sometimes that clears your ears. There are times, and it's not uncommon, for a patient to really have difficulty clearing the ears if they have a sinus infection, things. And they may actually have to go to an ENT physician to get tubes put in the ears, and then it pressurizes the oxygen between the inner and the outer ear, and it's not an issue after that point. There's a TV, you watch the TV, treatment's over, and you come back out, and then there's your treatment. But it does take repetitive treatments day after day to keep those high levels of oxygen up to see a result. So you won't see a result in a Monday through Friday treatment where you come in each day. At the end of the week, you're not going to really notice that much. And again, the healing started from the inside out. So once you do start to notice a difference, lots of other things have already happened to start that healing process.
And I'd imagine by the time you need hyperbaric chamber, you want that wound to heal.
Correct. Usually it's kind of one of your higher level of products you have in your toolbox for wound care. There's specific diagnoses that insurances will cover it for. There's other wounds that it may benefit from, but you also look at the insurance policies on what they will cover. So you'll see it a lot with your diabetic foot wounds. If they have a diabetic foot wound with the really bad circulation, they may have gangrene or bone infection, some of those things. You can also use it for radiation injury. Radiation is a tissue burn, and once you burned it, all that scar tissue does not have much blood flow or oxygen getting to it. Those are typically covered as well, but we don't see as many of the radiation burns, and I think it's because when a patient goes for their treatment, the resulting wound from a radiation burn isn't usually during your time of being treated with radiation. It can happen a year after your radiation, and then people don't put two and two together and think, you know what, this may be a benefit that would work. So that's something for patients to think about as well.
So, Kenchen, what happens in the wound care? Are there doctors that see you, or
it's a highly guarded secret as to what happens? So basically, a patient comes in, they get set up with a physician to be seen in the wound care center. You start off, at least with your first visit, is with the physician. The goal is to determine, like I mentioned earlier, about etiologies. So if a patient comes in and says, well, I stepped on something. Okay, well, we're not going to treat it just because you stepped on something. What is causing the healing delay? So first steps are investigating, what is that healing delay? Is it a circulation? Is it a blood sugar management? Is it infection? Go through that, and that's kind of where we focus the treatment on. Once we determine the etiology, we can really specialize the treatment plan as to what would benefit that type of wound better. And then as you come in subsequently, one time a week visit with a physician, as the wound starts to look good, it may be spaced out. There are times where patients maybe have a little more complex on their treatment, and you may have to come in extra and maybe just see the nurse to help with some of the treatments we have. We have negative pressure wound therapy, which is a wound vac, what most people know it as. Typically, those are not really easy for patients to do at home themselves. They'll have to come in. Patients with ulcers on the bottom of the feet, trauma is created every time they step on it. So we have to minimize the trauma. So we'll do total contact casting. And basically, it's just a cast you put on the foot. We'll choose a dressing that'll manage in between cast changes. And you'll have to come in, the staff would cut off the cast and reapply a new one. And that's usually done about twice a week. So there'll be times when you see a physician. Sometimes you may just see the nurse that's helping with the treatment plan.
So, Kenchen, how would someone that has a wound access care to your wound center?
Many patients don't realize that you don't always have to have a referral to a specialist on a lot of these insurance plans. So if you have a lot of your PPOs or even traditional Medicare, they can call up and just request a visit. I would rather somebody come and request a visit. We get them in and find out, well, really, they didn't need a wound care specialist. It's not that big of a deal. But I'd rather see plenty of those patients so that I do catch those ones that could have been a bad outcome had they not seek early treatment. If you contact like our wound care center, they would check the benefits. And if it does require a referral from your primary care physician, then we usually reach out to the patient to let them know they would have to set up an appointment with the primary care, request the referral to our center. and then we can work on the insurance authorization to start the treatments.
So would you give updates to the primary care?
We do, especially when it's a physician that's more local that we have more contact with. We have seen patients that have come in that are from maybe way off, or we never got their primary care information. We do keep the patient continuously updated as to how their wound is doing, what we're changing for the dressings, because dressings may change from week to week depending on what the wound's doing. So we could be constantly changing the treatment plan on a patient. We do try to keep updated. We do have physicians that request the updates. There are many physicians that it's not their specialty, so it's like, okay, well, we'll let them treat that. He'll continue to treat your primary conditions, and then they don't really care about the wound care so long as we're getting the patient better.
So you said with diabetics, a lot of times they'll step on things or poke themselves with something, or just even rub wearing the wrong shoes. Sounds like there needs to be proper foot care or examination.
There is, and every diabetic patient really should be seeing a podiatrist regularly. If I am not mistaken, under a Medicare plan, it allows for 2 visits every year. The main thing is your shoes wear out. So if you're wearing wore out shoes, you need a referral from a podiatrist sometimes to get your diabetic shoes so that it's covered by your insurance plan. The podiatrist is also just looking. Do you have any areas of calluses that look funny? Toenail trimmings. I've seen wounds from toenail trimmings gone wrong when somebody does them at home or they have a family member doing them. Really, if you're diabetic or have circulation issues, it should be a podiatrist doing your routine foot care. Never going to, what do you call the women use, pedicures. So you really shouldn't be going to get pedicures. I've had people come in that were in really bad shape. They went for a pedicure, and it really should not have been done on a diabetic patient with the way they did it.
Valuable information. So, Kenchen, are there some things that you'd like to add for the public to know? Because we see a lot of really bad wounds, and I've heard you frequently say, if we could have only just got that one sooner.
Early treatment is the key. Once something gets way out of hand, it takes a long time to bring it back under control. It is not uncommon for us to have a patient even come into a clinic for a year or more, depending on all of the other disease processes, the medications. Some diseases fight against you, like I said, the autoimmune diseases. Well, you could stop the medication you're on, your wound would heal faster, but then your other condition gets worse. So there's a collaboration we have to work on, but the main thing is getting in to have somebody look immediately.
And who heads up the wound care department as far as a physician?
So when there's a referral, the staff that are in the clinic, if they don't already have a doctor that they are requested, like the referring doctor, if they don't have somebody specifically or the patient have somebody specifically they want to see, then we look for one of our docs that's in the insurance plan to make sure that it's affordable for the patient. So we check the benefits, who's in network, and then also where is the wound located to know which route we would go. So if we have somebody that's wheelchair bound, maybe they're getting a pressure ulcer. Okay, well, we got a physician that can treat that. Again, like the diabetic. Somebody they're diabetic, they have a toe wound. We've got podiatrists that also see patients in the clinic, and that would be the most appropriate physician for them. And then if they don't have a podiatrist that they normally see, that also establishes them rapport with another physician so they can see them in clinic here for their wound care. And then their normal everyday foot issues can be seen with the podiatrist. Even once they heal, they can continue those follow-up visits at their podiatrist's regular office to make sure we don't have any future issues down the road.
And then you have infectious disease that kind of oversees.
So yes, we have internal medicine, we have infectious disease, and we have podiatry. And then we also work along the Oak Bend Medical Group for any kind of surgical coverage that we may need for any other types of issues that may arise.
Okay. I think it's really important that if you have a wound, even if you're seeing your doctor and y'all are trying to treat it and you just know it's not getting better or it's hurting or anything, it is always good to ask your doctor, can I go to wound care? Or call wound care and see if you can self-refer yourself.
Correct.
Because not doing anything can end up to really bad outcomes.
And wound care changes. So if you're doing the same thing at home over and over and you're not seeing any improvements, continuing that treatment's still not gonna see any improvements. So you really need to get somebody that has a knowledge in all the different types of dressings and options. In wound care, there's over 5,000 different types of products to use for wound care. So somebody that doesn't do that on a day-to-day basis is not going to be as familiar and know the options that patients have to treat their wounds.
Okay. So I think if you're feeling burning in your legs, or you get in bed and your feet are burning, or your legs are burning, or you notice red coming up on your legs, check your feet, wear the proper shoes. Those are all things that you can do to help. But if you notice those things, you need to see a physician.
Correct.
Sooner than later.
Correct. There are a lot of interventions that can be done to correct some of those underlying issues. And we've had patients come in and they didn't even realize those were an option, because they go to their doctor and they may not ever bring up that my legs have been burning, they're red, they keep going for blood pressure medication or any other type of medication, and they never bring these things up. So when they come into a wound care center, we're going to pull those pant legs up, we're going to take the shoes off, we're going to be checking every part of the foot, the skin, and trying to piece together the puzzle to figure out what direction do we need to go with this.
Okay. Is there anything else you'd like to add, Kenchen?
Just for patients to know that there are options out there. You go to a specialist if you have a heart issue. You go to a specialist if you need surgery. You're not going to go to a primary care doc. If you need surgery, you're going to go to the surgeon. Wound care is the same thing. It's a specialty in itself. If you have an issue with healing, you should also see a specialist for that as well.
And it is affordable.
Yes, ma'am. We do work with everybody with copays. Copays do not have to come out for every visit. We know these treatments get kind of expensive depending on how long they run. We work with the insurance. We look at what insurance will cover to stay within that, so that we're not putting stuff out there that is going to be a big financial burden on the patient if we can prevent that.
And it's really worth being prudent and checking into this stuff so you don't end up losing a limb or a life or getting a bad infection.
It does happen. People think, I'm going to try this, I'm going to try this, I'm going to try this. And then by the time they look for treatment, it's already irreversible, and people have lost a toe or a foot or a lower part of the leg from a simple little thumbtack sticking in the foot.
My family has personally had the experience of using wound care, and they have a phenomenal team. They do a great job, and I would recommend to anyone that is in need of some kind of wound care, get there sooner or later. I want to thank you, Kenchen, for joining us today, and a big thank you to our listeners for tuning in. Beginning now, set an intention and a relentless focus on living your life as the greatest person you can be in all situations. Please join us next week.
Thank you for joining us today on Oak Bend Medical Center Happy Hour podcast. We hope you enjoyed today's broadcast and invite you to email us at oakbendhappyhourpodcast@obmc.org with any questions or topics that you would like for us to cover. Remember, you can find us here each Friday at 5. Until next week, be mindful and stay healthy.